transport in London on the tube, buses throughout the country, National Rail and Transport for London bus. And they are all at much lower levels than they were prior to the social distancing measures being introduced. We've seen a reduction in motor vehicles too, but there is maybe a little bit of concern that that is starting to rise again, ever so slowly, but that's really important that we think about that. And on the next slide, this is, I think, a new slide, which takes data from Apple Maps, from people seeking directions or asking for directions in Apple Maps, and I'm sure similar will also be available from Google. This is a 7-day rolling average, and once again it shows a decrease since the lockdown measures were introduced of requests for walking, driving or instructions on public transport. Now, of course, the sun is out around the country, the days are getting longer, and I'm sure it's tempting for people to feel that they should go out, particularly as I'll show you in the next few slides, when we are beginning to see the benefits of that social distancing. But of course, I can't emphasize enough that we are far from there yet. It's really critical that people maintain their compliance with those social distancing instructions. It won't take much for this virus to start increasing its transmission again and to spread more widely. And it would be foolish and not right if we lost the benefits that we have gained over the last 4 weeks, which I know have been hard for everybody. So it's really important that despite the weather, we stay at home, we keep to the guidelines that we've been issued with. And then on the next slide, as I've said, we are beginning to see sets of data which show the benefits of complying with those instructions. So firstly, tests, this shows a number of new cases by testing, is reasonably stable. And of course, we are expanding test capacity all the time. So we may see some more positive cases through that expanded testing capability. But this is a fairly stable set of data now. And on the next slide, we show people in hospital with COVID-19. And you can see now we are getting a sustained reduction in people who are being treated in our hospitals, particularly in London, where you will see a steady decline, but also you will start to see the beginnings of declines in other parts of the country as well. And then on the next slide, we focus specifically on those small number of patients who unfortunately have to be treated in our critical care facilities, our intensive treatment units and our high dependency units. And you can see again, we are beginning to see a decline, although that decline will lag the overall number of admissions in our hospitals. Now we have new data here for Northern Ireland, and you can see that in the light blue line. And we've put that in to present a truly UK-wide picture. But I should just note that this is new data and it's not currently comparable with the other lines, as it shows cumulative data rather than daily, and that's why the line looks a little bit different on this chart. And then on the next slide, finally, this is the number of deaths in UK hospital. We report hospital deaths on a daily basis. These are reported deaths rather than the day of death. And you can see again that there is a trend towards a decline in deaths. That is a trend that will occur later than the decline in hospital admissions and critical care. But it's really critical that if we keep complying with the social distancing instructions, then we will begin to see a decline in deaths. Thank you.
Stephen, thank you very much.
Oh, sorry, there's one more slide, sorry. There is one more slide, which is the global death, sorry, Home Secretary, global death comparison, which again we show, and again, this shows UK hospitals only, but also with a lag on it, it also shows deaths in UK in all settings. So this includes deaths out of hospital, but as we've said on a number of occasions, there is more of a lag in the collection of that data. We're improving that, but there is a lag, so that is shown a little bit behind the hospital-only death reporting. Sorry, thank you.
That's great, Stephen. Thank you very much, as ever. I'm going to hand over now to questions. First question is from Lauren Moss from the BBC. Lauren, good afternoon.
Thank you, Home Secretary. Good afternoon. On the 28th of March, Professor Powis, you said we will have done very well if fewer than 20,000 people died during this epidemic, and we have sadly passed that number now. Does this mean the strategy should have been different?
Stephen.
So it's a very sad day for the nation. 20,000 deaths is clearly 20,000 deaths too many. And I think we should all recognise that my heart goes out, I'm sure everybody's heart goes out to the families who have lost a loved one, the families and friends of those loved ones. When Sir Patrick Vallance and I made that comment a number of weeks ago, what we were emphasising was that this is a new virus, a global pandemic, a once-in-a-century global health crisis. And this was going to be a huge challenge, not just for the UK, but for every country. And I think, unfortunately, we have seen that challenge, not just here, but around the globe. And even in countries that have got on top of this early on, we are unfortunately beginning to see new infections. So I think the first thing to emphasise is that this, unfortunately, is not going to be something that we will get over in the next few weeks. This is something that we are going to continue to have to work our way through over the months ahead. As I've said before, this is not a sprint, this will be a marathon in dealing with this virus. And I think the moving past 20,000 deaths just reminds everybody what I was just saying when I introduced the slides, that it is still absolutely critical that we continue to follow the social distancing guidelines, because we are seeing the benefit of following those guidelines. And we will only continue to see the benefit, and we will only continue to see reductions in deaths if we all continue